The Red Cross saying it could take a year to end the Ebola outbreak in the Democratic Republic of Congo. More than 780 people have now been infected with the disease and more than 180 have died. The BBC's Anne Soy has been to the worst affected province of Ituri, that's in the country's northeast.
Celebrating a patient's recovery. It's not often that medics do it this way, but this is very personal for them too. They've lost colleagues here, as well as many members of the community in Mongwalu. 49-year-old Daniel Kitambala is only the second patient to recover from Ebola in this facility. He says it's a miracle he survived.
I feel great. That disease is terrible. I was very weak, but I thank God I am now healed. I am so grateful. Praise be to God.
His recovery is also a huge morale boost for the medics here.
The outbreak has hit our community hard. Many people have died. At first, there was a resistance.
An isolation unit was attacked here earlier in the outbreak. An unusual illness has shaken the small mining town hidden deep in the hilly forested northeast of the Democratic Republic of Congo. The gold mines are visible from above. Ebola has spread across the community here and beyond. This is the other epicenter, Rwampara. Unexplained deaths ignited fear and anger here. Nearly a month later, people are now more aware of the outbreak, but the challenge of controlling it is still huge. Mirel Gahindo is a medic. Her toddler got Ebola, and then she too contracted it.
When I got sick, my child was first to be infected and had a fever and diarrhea. We got medication. After 2 weeks, the baby is now much better.
Her doctor says they are both out of danger, but they must first test negative for Ebola twice before being discharged. I spoke to her through a clear glass screen fitted with curtains on the outside. The curtains just hide that clear film, glass that has separated the patients from what is considered the green zone, the safe zone where people who are not infected can come. And this has made a huge difference because now they can come here 3 times a day to visit their relatives. The Budibunjo strain of Ebola responsible for this outbreak does not have any medicine to treat it or vaccines to prevent it yet, unlike the more common Zaire strain. But research is ongoing. For now, in the midst of so much death and desperation, the recovering patients are giving the much-needed hope to the healthcare workers and the communities they serve. Anne Soy, BBC News, Ituri.
Dr. Olivier Lepaulin is the World Health Organization's head of epidemiology for the Ebola response, and he has just returned from Bunia in the DRC and told me what it was like there.
Continues to be a really complex response. The sheer scale, both in terms of numbers, but also the number of areas affected and the extent of the outbreak at this stage makes it for very complex outbreak. Requiring significant support, and we're seeing more cases reported every day. In fact, an expanding epidemic still, and we've got, as of yesterday, more than 800 confirmed cases now reported, about a quarter of them deaths.
What's the biggest challenge that the teams are facing there?
Really, the sheer scale of the outbreak. So we know what the key epidemic drivers are. We know what needs to be done collectively. Ebola control is about trying to isolate cases and patients as early as possible for 2 reasons. One, because it really increases the chances of survival with early treatment in appropriate healthcare facilities, but also because it reduces the risk of onward spread in the community. That requires surveillance over a very large area. Currently, we still have some blind spots, and so surveillance needs to be increased. A huge amount of effort has been done over the last few weeks. We've got expanded laboratory capacity now under the leadership of the National Reference Lab and the leadership of the government, but more needs to be done. Some of the key challenges will be controlling the risk of infection within healthcare facilities. That's been a challenge for past Ebola outbreaks, and we see the same challenges here, particularly in that part of the DRC with a really huge network of healthcare facilities. And then access. It remains an area which in part is highly insecure, and response needs to be tailored to that context, really being driven by communities as well, but also tailored to the fact that the bandwidth and the footprint in some areas remains reasonably small given the ongoing conflict in some parts and the access challenges.
There is so much fear as well, so much misinformation and disinformation being put out there that many people really buy into and believe. How is the campaign to educate people?
A lot of effort is ongoing from various parts, and different organizations are involved in really what we call the risk community and communication community engagement, really working with communities not only to work on the key messages and explain what Ebola is about, but really also to understand communities and how they would want to see the Ebola response being managed. Essentially, we know what to do, but how to do it really needs to be tailored to communities. If that can be done, and there's community buy-in, of course, that really helps in terms of control.